So looking at the first section, what is a stroke and how do I know if I'm having a stroke? So primarily, this is the biggest reason. You've woken up with doctors in front of you and you can tell that you're not really the same as what you were before. Either you don't speak properly or you're not able to move as well as what you were before. And the doctor tells you you've had a stroke. Well, that's fine sometimes, but what does it actually mean? And so to give you a little bit more of a background, a stroke really is a brain attack. That is a medical emergency. And it typically happens whenever there is a change in blood supply. And that change in blood supply can be either due to a loss of blood flow from a blockage, which is known as an ischemic stroke, or if there's too much blood from a burst artery, which is more of a hemorrhagic stroke. In either cases, you're not getting enough blood or too much blood to the brain, which ultimately causes pressure or damage to the brain's surface and structures, resulting in some of the problems that you're experiencing. So what do I do if I think I am having a stroke? Well, the very first thing that you always want to look into is remember the acronym FAST. F is for face. Often we're looking at this smile. Is one side of your smile a little lopsided, or is it drooping? You're not able to move it. The second part is your arm. Can you raise your arm? And do both arms go up at the same time, or does one sort of lag behind or move slower? Speech is the next part. And are your words slurred, or are you even having a hard time pronouncing or understanding or making words happen? And then lastly, the T is for time. This really is a medical emergency. At the onset of any of these symptoms, you want to be calling 911. Because a lot of the times what happens, the longer the time you wait, the less brain function you are likely to have afterwards. Make sure you get there as fast as you can. You also want to remember that if you have access, you definitely want to use an ambulance to get to the hospital. They're able to help you if anything is to go wrong during the course of getting to the hospital. And then just in case, to kind of bring this all back together again, once again, just think of the acronym FAST, right? So face, arm, speech, and time. And then follow up with the use of either a call to 911 or the use of an ambulance. So why is it important for us to actually get to the hospital right away? Most important thing to remember is time lost is brain loss. The faster you're able to get to the hospital, the better your outcome most likely is going to be. We don't really know what type of stroke you're going to have. In the event that it is an ischemic stroke, in which you've got a blood clot or a blockage in the brain, the faster you get to the hospital, you're more likely to be able to receive a certain type of medicine that helps break down the clot and therefore restoring normal blood flow to your brain. If you get the blood flow back to your brain, the less of a problem you're going to have with your function thereafter. And typically this type of time frame, if you are having that ischemic stroke, you want to make sure that that's happening within the first 3 hours on the onset of your symptoms. That's sort of the time frame that we're able to make sure that you're going to be able to get more function out of your brain afterwards. So now that you've obviously had a stroke, what exactly has happened in the brain? We'll focus more primarily, at least initially, on the hemorrhagic stroke, which is, once again, it's that ruptured artery. And if you look at the very bottom picture, in which you can kind of see there's the big bubble out on the artery and you sort of getting those platelets out on the side. So that's going to be on the left-hand side. That's our hemorrhagic stroke. It's not a very common type of stroke. It only happens about 15 to 20% of all strokes. And this mostly is due to either high blood pressure or artery abnormalities or even tumors within the artery. So just there's something wrong within your actual vessel itself, which makes it more likely to have some sort of rupture or abnormality. The second type of stroke, which is the most common type of stroke, is really an ischemic stroke, which is also the blocked artery. And you can kind of see, just looking at the right bottom picture, that's a lot of fatty deposits or cholesterol that is built up. And what that causes or does is it actually decreases the amount of space that you have within the artery So it then makes it harder for blood flow to get through. As that space starts to narrow, you're starting to get a build up of your blood pressure. And as it builds up, it makes it harder for even the blood to get through. So any points past that blockage, you're not going to get the blood flow going through. So going back and really having a look at our picture here at the brain, on that right side of the ischemic stroke, you can sort of see there's an area that is covered with sort of like a dark brown or a bluish kind of color. All of that area, the surface of the brain, is actually an area that is not getting blood. And when it doesn't get blood, it's starting to sort of, essentially the tissue is starting to die. The more dead tissue you have, obviously, the harder it is for your tissues to start to come back and for you to be able to use those brain structures again. This type of stroke, once again, the ischemic stroke, is typically between 80 to 85% of all strokes. And it is largely associated with things external to your body. So it's things that are really within our control. So it's often a result of the type of diet you have. If you have diabetes, your high blood pressure, and a lot of times a lack of exercise are some of the main causes for why you would have this type of stroke. All right, so that's just our general description of what different types of strokes are, why it's important, and eventually we're going to get into the next sections of how do we manage it and therefore how do we further prevent it.